Roe was never enough. There were already millions of people who struggled to get the abortion care that they needed. In preparation for the fall of Roe, our team essentially looked at a map of the region. And in doing so, we saw that there was this huge abortion desert smack dab in the middle of Appalachia, and that Western Maryland was the closest state that was going to be an abortion access state. And we thought, well, what would it take for us to open a clinic there? So this was really a community-based labor of love clinic that came to be. Today is a moment to appreciate our tenacity and commitment that made the dream of this clinic a reality just a little over 1 year ago. Today is also a moment for us to hold and acknowledge the immense grief we live with daily, knowing that our community in West Virginia has lived under a total abortion ban for 2 years. Today is a moment for us to receive our flowers. Abortion care is a labor of love, and today we feel that love reflected back to us. Today, personally, is one of the first times that I've actually stopped and paused to reflect on all we've done over the past 2 years since Roe was overturned.
The practice of blessing abortion clinics is so central to the work that we do now for several different reasons. One, we know that reproductive health centers that provide abortion care have been attacked by people of faith for decades. And so to show again to healthcare providers and their staff, there are many of us who believe that what you do is sacred, and we want to do some of that acknowledgement of the harm that's been done and also hopefully promote some healing for people. I think it is especially important when our opposition uses faith language to make sure that we are speaking back in faith language so that other people of faith can see that there are lots of different ways to approach this topic.
I've dealt with a lot of social issues, believe me, and I've seen they're all linked. They're all linked. All linked to racism and misogyny. All.
When I hear them talk about protecting women, and women don't want this reproductive stuff. They want to go back to a traditional conversation. When I hear this is blasphemous to me. We better stand up to it. And I think we are. I think we will.
I don't know what I would have done if you guys didn't put the clinic out here, so I know from the bottom of my heart, even though I don't speak for the queer community in Cumberland and the trans community in Cumberland, I know we all really appreciate what you guys are doing.
To come and be a part of something like this with faith leaders who truly just exude that type of support, but it helps you to feel safe, and that is a breath of fresh air.
There was a theme that ran throughout the day that was grief to hope. We do the blessings not only for the staff and the patients of the clinic, but also to help other clergy claim the power of their own voices to say, God is that big.
This was a beautiful day, but there will be more difficult days ahead. And so we want to make sure that it's not just about the moment, but also thinking about the relationships that they'll have with the clergy moving forward. And so I think our job is really to facilitate the beginning of those relationships and nurture them and hopefully help foster those in the future as well.